Well, good afternoon, everyone. We want to thank you for joining us this afternoon for the Flint Community Webinar on Coronavirus. For those of you that are joining us via Facebook or via YouTube, Zoom, whichever way you've joined us, even on your phone today, we appreciate you for joining us this 108th week of the webinar, April 8th, 2020. This webinar is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. I'm your moderator today, Yvonne Lewis, a co-director of the Healthy Flint Research Coordinating Center, and we are, again, extremely delighted that you're here with us. We want to encourage you today that you would provide us some questions and comments in the chat if you're joining us by Zoom, or you can also send notes to us in our email, info@hfrcc.org, or you can also give us a call at 810-835-2130. Today, we have a very exciting day for you today. We want to first acknowledge our number of partners, over 45 partners that have joined us every week, and you will hear from some of our partners today. They are panelists in the background ready to answer those questions for you as you put those questions into the Q&A. Even if we're not particularly addressing some of these questions today, we still have Genesee Health System here to answer mental health questions. We have representatives from our organizations. The University of Michigan will be here to help us answer some questions. Community Foundation of Greater Flint is here with us today, Genesee Health Plan, and more. So please feel free to put those questions in as we move through our webinar today. Our focus for today will be COVID versus chronic illnesses. We're going to talk about a new initiative that's coming up, NNICE, COVID vaccine equity, health equity update, and of course, we'll hear from the Genesee County Health Department and the City of Flint. It is our pleasure also to advise you that this is National Minority Health Month. And during National Minority Health Month, we elevate those issues that particularly are impacting our minority communities. The theme for this year is Give Your Community a Boost. Now, this can be looked at more than one ways during the month of April. Of course, we're still in the midst of COVID, so they're talking about vaccines and so forth and getting those boosters. But we also want you to give our community a boost by getting involved and helping make a difference. One way you can do that is think about this week. This is National Public Health Week. And during National Public Health Week, which is an initiative of the American Public Health Association, it is an opportunity for us to impact our communities right where we live. What kind of things are we doing to make a difference in our community? We can be stronger and safer if we work together. We were excited about what's going to happen. And I want to just tell you some of the things that they're going to be focusing in on. One of the things is we're thinking about in COVID, we're still saying keeping safe, distance, and together. When we talk about social distancing or physical distancing, it doesn't mean we can't communicate, but we can still find ways to interact with each other and do it in a safe manner. There are 5 categories I want to point out to you that are points of emphasis: racism as a public health crisis, community, collaboration and resilience, human rights, accessibility, closing the health gap, equity gap, and climate change and mental health. These are issues that will be ongoing, however, particularly focused during Public Health Week. If you can go on the website and look at the American Public Health page, you'll see some of this information loaded in there. When we talk about public health, accessibility, closing the gaps, I want to bring forward our roundtable team today. For our roundtable, we have Dr. Jennifer Edwards Johnson, who is a family practice physician at McLaren. She is also a community assistant dean at Michigan State University. Nurse T, we affectionately call Nurse Tarnisha Martin, doctor who is from Hurley Medical Center, the community advocate. Dr. Lawrence Reynolds, who is a health interim president and CEO of the Greater Flint Health Coalition, and Dr. Susan Wolford, who is associate professor for pediatrics at the University of Michigan, who brings us those medical moments every week. They're going to be our roundtable today, and we have a question that has been posed to us. Nurse T asked this question last week because this question was raised by some of our community members as we're out and about talking with community members. And the question was, if in fact, why, let me ask it this way, when we're talking about resilience and how our communities make a difference and fill this equity gap. So I'm going to ask Dr. Reynolds and Dr. Wolford to join me here. And let's talk about question from community. There's been so much focus on COVID. There's been so much focus on vaccines, so much focus on getting people tested around COVID. What about those other chronic illnesses that people have been facing over the years? Why aren't they as elevated as COVID? How would you respond to that?
Thank you so much, Yvonne. This was a really interesting question that Nurse T posed. And I think one of the reasons why is because of how dramatic COVID was, right? And is. So it was so very new. We knew nothing about it. It was so clear that the disparities that we were seeing here, you couldn't miss it. People who were not following health disparities, who didn't know anything about health equity, had to be aware that, oh my goodness, communities of color are being disproportionately impacted by this. They are getting it more than others. We are dying in larger percentages than others. And so it was hard to ignore. And I think that the way that it occurred, it was so dramatic that it warranted attention. And people, there are those who care and cared that this was impacting communities of color in the way it did and wanted to do something about it. And so that is one level of interest. I would like to suggest that there might be another level of interest in that I think many of us are most focused on things that impact us, right? We're busy raising kids and running a household and doing the things that one has to do. And it's not a lot of time to think about other things, but we are concerned about things that impact us. And here's the thing with COVID, as with any other contagious illness, that even if my next door neighbor isn't affected if I have high blood pressure, right? It doesn't affect them in any way. Mm-hmm. But if I have COVID and I go visit them and I cough on them, then they are likely to get it and they're likely to suffer. So I believe that at some level, even the interest in getting communities of color, for example, vaccinated and getting everybody who can be protected, yes, at some level it is because people might care, but it's also because people care to protect themselves as well. And we know we're all connected and we cannot all be protected. We cannot all be safe from the virus unless we have high levels of immunity throughout the community.
So Dr. Reynolds, as we look at this, we've talked about chronic diseases over time. Can you help bring some clarity to this conversation as well?
Well, we get to the point of, I want things to return to normal. Normal was never good enough. We need to establish a new normal, and we need to continue our focus on health equity, access, care, and outcomes. And we've done dismally poor. I'll give you a historical reflection. After the Civil War, in the freedmen's camps in Northern Virginia, there was a smallpox outbreak. And it was devastating for the newly freed folks in that area. That's where my medical school started. But there were people in government who were saying, well, Black folks can't live free. And we should just let them die anyway. And these are people in office. And it will take care of itself. Well, what happened is smallpox does not respect race. So it spread to other communities. And it even became an event when blankets from those freedmen's camps were taken out west to Native American areas and spread smallpox there because they had minimal exposure in the past. So these disparities exist a lot because they're allowed to exist. There were social determinants of health back then. There are social determinants of health now. Income disparities, housing disparities, access to care disparities that we still must address. And I'll give you an example. I signed up one of my younger brothers, we're all over 60 now, for his 4th booster. And he went to get his booster, and thank goodness the pharmacist checked his record and said, well, you know, you need your tetanus diphtheria booster. You also need your 2nd pneumonia shot, and you need your COVID-19 booster. And so he was given all of them. And, you know, this is, you know, so we forget as we move from one age group to another, there are things we have to do. And then I'm going to speak as a pediatrician. When we move from one age group to another, we forget the things that we did that helped us get here successfully. And then we have the whole issue of appropriate diet, living in food deserts. And I'll just sum it up by saying your zip code, and we've heard it before, your zip code should not determine your lifespan.
Right. So we often talk about Dr. Reynolds and Dr. Wolford, and I see Dr. EJ, she's going to join us in this conversation as well. But health is more than the absence of disease. You know, so that's why we talk about the social determinants of health, which means those other things that are not necessarily, we might not look at them as health related. But when we think about the absence of a grocery store, that's a health issue. When we think about the lack of jobs, those are health issues. So I want to phrase this, so we look at it, you know, this health equity gap before COVID, as you just mentioned, Dr. Reynolds. It's during COVID, and it will be beyond COVID. So it will be important for us to continue to address these issues. And this is Dr. EJ, wanted you to kind of chime in here when we talk about this conversation as well. Chronic diseases versus COVID, and why now so much emphasis on COVID versus all those years before and during COVID, the emphasis on chronic disease doesn't seem to have been elevated as highly.
Can you guys hear me okay? My internet in my office went out for some, okay, perfect.
Yes.
So my apologies. I think this is such an important issue. As a primary care doctor, we're dealing with chronic diseases every day. And I think there has been a real emphasis on COVID because it affects, you know, I think we talked about this last week. It can affect anyone. It might be, you know, it's an infectious disease, right? So you're riding the bus, you're in a grocery store, you're at risk for COVID. COVID is also acute. It's right there in the moment. It's something that we're dealing with, you know, barring our conversation about long COVID, it's something we're dealing with in a very short period of time. The symptoms and the fallout from COVID are something that are impacting our hospital systems in an acute period of time, a short period of time. And it feels like we don't have as much time to be able to address and take care of COVID like we might have for chronic conditions. When someone comes in with hypertension or diabetes, these are often discussions we can have over a period of time as a primary care doc or with your primary care doc. There are often things that I am encouraging or trying to make sure my patients are connected with in terms of resources over a period of time. Dr. Reynolds mentioned multiple social determinants of health. All of those play into chronic disease. And those are all things that we're trying to piece apart in our doctor's visits over a long period of time when we talk about chronic disease. I think the focus on COVID, again, has been anyone can be someone who gets COVID. There's a lot that we don't know. We have a lot of things that we're learning on the fly, and we're learning new information daily. And it is something that we're trying to educate the public about, because this is something that the public and physicians are learning about in real time. With chronic diseases, these are things that we're hopeful that as you get with a primary care doctor, as you work with your primary care physician, you're able to, you know, understand and treat. But I agree that there needs to be an emphasis, and it's something that really affects our communities.
So when we talk about that acute issue, and all of us, because who thought in our lifetime we live in a pandemic, you know, and I heard one infectious preventionist say that a bug would be so contagious that people would get infected so quickly and die so quickly in this short period of time. And we're still not out of the pandemic yet. So we want to remind us of that. But one of the reasons we don't know as much is because it's so short. Now, Dr. Wolford, you also serve as a researcher. And so can you highlight for us, even in the midst of COVID, why the research is so important and some of the things that are being learned from that, the research process?
Yes, it's amazing, Yvonne. This idea that we would live through something like this was very unexpected. And although they've happened in the past, and so it was a little bit optimistic to think that they would never happen again. But I think that we believed that with the advances in science, that we wouldn't have the same kind of death toll as previous pandemics had when they didn't have the scientific advances that we've had. And so what we have learned is that there is a lot more to managing a pandemic than getting just the treatments for it, right? So while there was a lot of money and a lot of research put into developing the vaccine, which was really incredibly important, we needed a safe vaccine, and now we have a few safe vaccines. But there was a lot of research in that regard. We've realized that there needs to be a lot of research in addition to that. So how do we help people accept the vaccine? Has do we ensure that communities of all stripes will be willing to take it? How do we follow up on, once the vaccine has been given, monitoring, in fact, the outcomes of that? And we're very good at that kind of research. Looking at the ways in which different treatments are people willing to take, right? So that we can have other options like monoclonal antibodies, so that we can have like Paxlovid, pills that we can take to manage it. And then there's even more research that's needed because we know there's a mental health toll from this. And so we have to follow the research in that regard. There's so many areas that need study and not just one. And so I think that there is a need at this point for even more investment. And I think there's a realization of this, at least at the NIH and maybe even federally, that there is a need for more research in all of these different areas to ensure that all communities are protected from the impact of this virus and others that might come along.
And one of the things that's important for the Healthy Flint Research Coordinating Center is that we have community voices come forward, ask these questions, and participate. Now, we're not all participating in clinical trials where we're getting a drug, but we are participating in research that allows us the opportunity to share our voice so things can be looked at from a different perspective. And so, Dr. Reynolds, we're just about to wrap up this segment, but I want to come back to you and say, you've always kind of kept us grounded. You know, you were serving as the Chief Public Health Advisor for the city, and I called you the city doctor, but you help us stay grounded. And so if you can just give us those tips about, even in the midst of the research is going on, what do we need to do as community members to stay grounded during this continued conversation? You're on mute, Doc.
We as providers have to remain humble, as my colleagues have alluded to. Things are changing. We're learning more and more. So what we said a year ago may not necessarily apply to what's going on right now. So if we change our message, it's because we have learned more. And if you know better, you're mandated to do better. And this is what we're doing. I got my 4th booster. Okay, another booster may be required because we're learning more. And I say the virus has learned how to evade some of our prevention strategies, and that's why we must still have that layered approach. One will not do it. Use your brain, get vaccinated. When in doubt, put that mask on. And I'm not going to talk about other people's families, but if you come to my house and I don't know your vaccination status or you're sick, if you get in, you're going to wear a mask. Okay, if I go out in public, especially to an enclosed space, and I know nothing about the people, like when I go to worship on Sunday, I put on a mask and I keep my mask on. And it's not just for me, it's for the other elders in the church, for the unvaccinated in the church, and for the young people in the church. And the same thing applies to our schools, our workplaces, and any other social gathering. And so we're not saying don't associate with anybody, but maintain that physical distancing. Wash your hands and listen to appropriate messaging from credible sources. And some people will say, well, the CDC said this last week, but last year they said so-and-so. And yes, it would be foolish for us not to change our message, our information, and our treatments as we learn more. Because as I said, if you know better, you do better. And that applies to all of us.
Thank you, Dr. Reynolds. Dr. EJ, I want to just come back to you because that comment that Dr. Reynolds made about may not apply, some things may not apply, so important to have a primary care physician and ask those questions. So I'd like you to just talk to us a little bit about why it's important to have that primary doctor and ask the question. One thing you told us before is how much you have to study. And so we rely on you to study to be that credible messenger. So can you just give us that insight? Why ask these primary care questions?
Absolutely. When you think about any new thing that might come up regarding your health, you need to have someone that you trust and that you can go to, right? And you need someone to steer you in the right direction, answer your questions, and your primary care doctor is well poised to do that. They are the ones who can tell you, hey, do I need a booster, right? Do I qualify? Do I need that booster? They're also the ones that are going to help you think about your chronic disease management. Hey, doc, I have hypertension in my family. Am I at risk? Do I need to do anything? Hey, doc, diabetes runs in my family. What do I need to do? I just came from clinic today and had a wonderful interaction where someone was saying, the stress of the pandemic has just been really difficult for me. I have children, I work full time, I have all of these responsibilities, all of these different hats that I wear. My kids are in activities, and I just wanted to tell somebody. And I was happy to just be the person that would listen. Didn't want anything else, but just wanted to be able to say, there's a lot going on. And am I crazy to think that there's a lot going on? Right. And so it's an opportunity to have a discussion about what the next step might be, if there is a next step, and what you might need and how we can get those resources to you.
Thank you. And I'm so glad you're in the College of Human Medicine helping us train some of those physicians that are coming on. Please keep working with our physicians. Thank you, Dr. EJ.
Love it. Thank you.
Yeah, Dr. Wilford, last point for the roundtable today.
Sure. I just want to get us back to Nurse T's question, right? That many people in the communities of color are saying, why are people pushing the vaccine on me when they're not concerned about my health in any other way? And I want to I usually use food analogies, but I want to use a garden analogy. Say that my front garden is a mess and my neighbor, like it's got all weeds and whatever growing. My neighbor is not concerned about my garden because they're concerned about me. They're concerned about my garden because of the value of their house is going down because my garden isn't very healthy, right? My garden isn't looking good. Their value of their property is going down. That's why they're concerned. So they say to me, okay, you use this weed killer. It will help your garden. And they offer me the weed killer. And I'm like, I'm sorry. You've never done anything else for me. Why are you giving me weed killer? I don't want to put that on my garden. Maybe it's going to poison. But if I see them put the same weed killer on their garden, then I might believe, oh, maybe it's safe. They don't really care about me necessarily, but they're willing to give me something good because it will help them too. And so I think we can see a little bit of a connection with the vaccine. We know that people who we trust, who are maybe not part of our community, but are well connected and lots of knowledge in this area are taking the vaccine, giving it to their families, giving it to their elderly, giving it. So we can have a little more assurance that it is safe because they are taking it whilst we don't have to believe that they're concerned about us. We don't have to believe that, but we can see that this vaccine is likely very safe because those who are saying that we should take it are also taking it themselves. At least to their knowledge, it is safe. I hope that makes sense.
Thank you, Dr. Reynolds, Dr. Wolford, and Dr. EJ, and all of them have gotten their vaccines, but they are saying to us, ask those questions. You know your health. Nobody knows your body better than you. And sometimes we don't even know our bodies that well. We got to ask ourselves, but let's make sure we talk to our primary care physicians and those who have spent the time getting this information so we can know. Partly sunny, partly cloudy. Let's get those umbrellas out and make the best decision possible. All right. Thank you, team. We talk about our community being resilient, and I struggle with that term sometimes because resilience suggests that we're just going to keep bouncing back. But one of the things I say about the Flint community, the Stones that are here in Flint, is that we are resistant to letting things continue to be so. Therefore, we're excited about a project that's happening at the Community Foundation. When we look at collaboration and resilience, not just bouncing back, but standing up, stepping out, and moving forward. Lydia Stars is here with us. She's a program officer at the Community Foundation. She's going to let us know about some activities that are coming up that can make a difference for us here in the community. Welcome, Lydia.
Thank you, Yvonne. Thank you for inviting me today to share a bit more about the National Network to Innovate for COVID and Adult Vaccine Equity, otherwise known as NNICE. CFGF is happy to be engaged in this project because we knew that we had a lot of community-based organizations and nonprofit partners who were working on COVID-19 and flu vaccine equity, and they needed additional resources and supports to be able to accelerate that work. So Flint is ready, they stay ready, and with additional resources that we're able to get to them, they've been able to really launch some new and exciting initiatives. So NNICE is a funded project through the Centers for Disease Control and Prevention, the CDC, as part of their national strategy to really focus on racial and ethnic minority communities and vaccine equity. Michigan State University is the lead organization. They're the primary grantee of the NNICE funding support, and led by Dr. Fur Holden in this effort, getting things up and running. She's been fantastic, and the whole team at MSU has been so supportive in helping our implementation sites really get up and running. We received funding late summer, I would say, of last year. So it's been a whirlwind trying to get things moving pretty quickly, but we've all been able to do it with their support. The purpose of the NNICE program is to help us in our communities implement effective interventions to improve vaccination coverage and implement strategies to reduce racial and ethnic disparities in our communities, particularly related to adult vaccination for African American and Latinx populations, getting them the COVID-19 and flu vaccine. So as I mentioned, this is part of a national strategy from the CDC. They have invested millions of dollars across a variety of organizations and sectors and partners in order to really address racial disparity in vaccination access and uptake. So you can see we're over here in this bucket of folks in the left-hand corner of the screen, the academic institutions, but there are a number of ways that CDC is trying to invest and infuse resources into communities. We actually even have another vaccine equity focused project in our community through the Greater Flint Health Coalition that's been funded by CDC. So there's more than one entity in this community that's working with CDC on increasing those numbers. But overall, they've also been able to provide a lot of technical assistance and other capacity building resources, which is really helpful. So peer learning opportunities are available to the implementation partners and our funded grantee partners. New resources are available to them, marketing and communications, so they're not having to recreate a lot of things that already exist. And then additional training and expertise is available to them as well. There are more than just Flint in terms of implementation sites and partners. So Baltimore, Maryland, the Eastern North Carolina region, Flint, Michigan, of course, and then West Michigan, there's a few different partners over there, all focused on getting these federal resources to community-based grassroots organizations to implement promising practices, as we'll describe here in just a moment. So some of the eligibility criteria for the project, of course, you needed to be focusing on addressing the distribution and administration and uptake of COVID-19 and flu vaccine for African Americans and Latinx and Hispanic individuals. And for us, of course, it was focused on Flint, Michigan. They had to meet some additional criteria around the type of interventions, reaching multi-level interventions. So they had to get 3 of these categories at least, which it may seem like a barrier at first, but once you start to dig into this, these are really interconnected. And so this was not necessarily a barrier, and most of them hit all 4, if not 3. And then they have to implement 2 promising practices. And again, our team at MSU, they did a large scale literature review. There's not a whole lot really out there yet because COVID-19 is so new, but they did look at the reviews and studies that had taken place about what promising practices might be affected, or do we need to continue testing and trying in community? And so they came up with these 8 promising practices. Grantees selected 2, which many of them selected at least 4 or 5 of them to implement. But they went from community-based distribution sites. They can host new pop-up clinics or even schedule ones that have more frequency in community. Funding immunization champions. So these are community level folks who are really here to, be the loudspeaker for the vaccine and ensure that folks have the education and information and connection to those distribution sites. Community specific or subgroup specific public health education campaigns. So these are making sure that messages get to very specific populations. That could be a zip code or a neighborhood or congregation specifically. So we had a lot of nonprofits select that as one of their promising practices. Electronic health record vaccine reminders. So this is more of a health system, health center based type of intervention, but this is something set up in the electronic health record system within the practice that would remind folks of when they need to get that vaccine. Mass public health education campaign, so that community specific messaging just on a broader, larger scale, really trying to cast a wide net with those messages. And then medical system immunization champion. Again, a more health system, health center based role where it's someone within the practice who is the immunization champion. They're the one that the staff would go to if they have questions or need information, or they might send a patient to for additional information. Patient vaccine navigators. These are folks who are out in community really helping people to navigate the how and where and getting to and from those distribution sites and vaccine access points. They really provide the additional level of support to individuals. And social media diffusion of knowledge, a really important topic that we need to be funding and supporting, because there's a lot of misinformation and inaccurate information that's been on social media platforms. People really having concerted efforts to push out false narratives to reduce the number of people who get these vaccines. So these are all of our funded projects. We now have 13 funded projects, I believe. We had an initial round of grant making that we did, and then we just finalized a smaller round of grant making. So the process was sort of similar to how we do most of our grant making. We invited a number of nonprofit partners that we had relationship with, many of whom we knew to be doing this type of work in community and really needing some additional resources, or perhaps they were census grantees who we knew had a track record of being able to really get deep into communities with information and resources. And then we had an advisory committee of community volunteers and leaders who were able to work with us through our review process to award these dollars. So we had $750,000 to award into community, and I think we are just like 20,000 shy of that. And I am absolutely going to spend every single dollar. I told Dr. Verhoeven and Dr. Uphold that I would not send a single penny back. So we're hoping to get those additional dollars into community ASAP. But all of these groups together, we're hoping to provide support for them to collaborate during the implementation of these projects. We met earlier this week, a small group of us, and we're starting to coordinate and plan around how we work together on planning our messaging, planning our outreach, just even sharing with each other the information about upcoming events that we might be hosting. there's a lot of overlap in the strategies that folks are implementing and the areas and community where they're trying to reach residents. And so we want to be sure that we're not trying to compete over, a billboard on a certain corner, that we all know where we are in community and we're working together.
Thank you so much for that, Lydia. And just one quick thing, when you talked about that, working together, that's how we're going to reduce some of these disparities. And we want to encourage our community members, when you see these billboards up, give us some feedback. Let us know if these are making a difference for you. So in the next few months, they're going to be seeing a lot out there, and that's going to help us with our goal of closing this equity gap. Early on, we heard many people say we didn't have access. We don't know where to go. Thank you for providing this funding through this process to ensure that our community organizations, and if you look closely, 5 of those promising practices had community engagement involved in them. And so this is really, really important for us to, I hope you understand, those of you that are listening, how important community voice is, because it's a community voice that made this happen. Last comments for us, Lydia, before you leave us. You're not leaving us, before we shift to our next topic.
Just thank you again for having me. If folks have questions, or if you want to know more about any of the individual projects, you want to connect with those organizations yourself, you want to share the work you're doing, I'm here to be a facilitator from our funded partners under NNICE with any other partners who are doing similar work in community.
Thank you. Lydia Stiles from the Community Foundation of Greater Flint. Thank you so much. Now we're going to shift over to the health department, because when we talk about, again, closing these gaps, and it's really important that we understand what is present so we can look more closely at what we need to do and how we need to address it. So today, Ashley Herbig is here with us. She's the Emergency Preparedness Coordinator for the Genesee County Health Department. This is her first time with us, so we welcome you today, Ashley.
Thank you so much. It's a pleasure to be here. So we'll start with Genesee County COVID-19's data, case updates. To date, we have 101,261 cases. This past week, we have seen a confirmed case decrease by 45% and a probable confirmed decrease by 21%. The proportions of cases are still, the predominant age group is 25 to 39, with our predominant race of Caucasian, ethnicity of non-Hispanic, Latino. Again, it's almost equal for gender at this point, 43% male, 52% female. Next slide. As far as vaccination rates go, we have administered 403,590 doses, all doses, including first and second. 84,416 of those have been administered by the Genesee County Health Department. It is good to know this information. 52% is fully vaccinated within Genesee County. That's including populations over the age of 12. I imagine that this dashboard will be updated once we have the data to promote those 5 and up as well. Genesee County COVID hospitalizations, we do keep a close eye on this. This is one of the roles that I play at the health department. I monitor our hospitalizations in respect to our COVID data. So at this time, we are seeing a substantial decrease in hospitalizations right now. We are on the decline. We are showing higher openings for ICU rates. So what we do is we make sure we monitor inpatient numbers, any flux in those numbers, as well as ICU numbers. We monitor patients based on age, as well as vaccination status, as well as the severity of disease, ICU admissions, ventilations, so on and so forth. In tandem, we also make sure that we monitor their resource rates. So we do monitor their PPE, as well as their ventilators and their monoclonal antibody supplies.
So Ashley, just a quick question here. I know that the CDC changed some of their guidelines. We were looking at case rates before. So again, the significance of this is that there will be more attention given to what's happening in the hospitals versus case rates.
Correct. So from the health department standpoint, point, we do follow CDC guidelines. We follow their updates as closely as possible, as we all know that updates can change by the minute. So we try to make sure that we see any kind of correlation between changes, vaccination rates, whether they're increase or decrease, case rates, whether those increase or decrease. As of right now, with an increase in cases in Genesee County, we can expect to see movement in the hospitals or an increase in admissions, regardless of age, typically between days 15 and 17. So we do keep that in mind. We keep in mind what the CDC is recommending from all aspects, including hospitalizations, medical interventions, PPE use based on presentation, and so on.
Thank you.
Yes. As of right now, we do keep a monthly tally, so to speak. We keep track of those as far as vaccination status of hospital admissions. Typically in the past, we were seeing a pretty substantial disparity between those that were fully vaccinated as opposed to that were partially vaccinated, unvaccinated, or vaccination status unknown. As for the month of April, we are showing 50%, but that may be contributed to the fact that our hospital inpatient numbers and daily average admissions have declined as we would expect based on our case counts. We were averaging in the high 20s in December, January for daily average admissions, regardless of age. We are averaging for the month of April. Granted, we are in April 8th, so it's only 8 days in, but we are averaging 1 admission a day. Most days I'm seeing from my end, no admissions for the day, which is great news. Our hospitals were definitely feeling the impact when we had those high daily averages. If you can see our monthly inpatient totals, December was our peak for 902 admissions across all 3 hospitals in Genesee County. So far in April, we only have 7. So that is promising, some promising data right there. Checking in with all 3 hospitals, everybody is in good spirits as much as can be. We try to make sure that we are openly communicating with all 3 hospitals, as well as all other medical providers, that if they have any barriers or needs that they are presented with, that we do take it back to the team and do what we can to help the best that we can as quickly as possible.
We want to thank you for that, Ashley, because we did receive a lot of questions about what's happening in the hospital. So we appreciate you bringing this information forward.
Absolutely. We were very aware of the piqued interest from not just medical providers or community partners, but just the public as well. And it is good to see, firsthand updated data to show that their vaccines were showing a promising impact, and they still are showing a promising impact to keep people out of the hospital the best that they can, help promoting the message of reducing the burden in the hospitals by, as was said before, that multi-layered approach of wearing a mask, washing your hands, social distancing. If you feel ill, stay home, get tested, be mindful of others and protect yourself to help protect others as a positive result. Next slide, please. So our clinic schedule at this time is a rotating schedule. We have 3 sites established with the Genesee County Health Department that we rotate based on the weeks. So we have 2 that work on weeks 1 and 3, and 1 that works on week 3 or 2 and 4. Sorry, it gets confusing sometimes. Right now, we are still partnered with Our Lady of Guadalupe Church, as well as Central Church of the Nazarene and Shiloh Missionary Baptist Church. Our Lady of Guadalupe Church runs on Tuesdays, Shiloh is on Thursdays, and Central Church of the Nazarene is on Wednesdays. We are very aware of the updates for the CDC parameters for secondary boosters for those that are eligible for it. We promoted that immediately to make sure that those that wanted it and were eligible for it could get it as soon as they wanted it. So we do make sure that we are very transparent on which clinics offer what. So in this case, Pfizer first, second, third doses for 5 and up, Moderna first, second, and third doses for 18 and up, booster doses as appropriate for 12 and older. We do take that into consideration. That's one location does not offer Johnson & Johnson. That's going to be Our Lady of Guadalupe Church. So we do make sure that we're transparent when we relay this information to the public, that if they are searching for a Johnson & Johnson vaccine and they want to go to a GCHD clinic to attend either Central Church of the Nazarene or Shiloh Missionary Baptist Church. We still have the 3 clinics at this time that are partnered with MDHHS and HANU. That's going to be our Word of Life Church, Bethel United Methodist Church, and then Macedonia Baptist Church. They all run on different days, as Sherelle has said in the past. They try to have a rotating schedule, so at least one site is open at any given day, apart from Sundays. Additionally, we do have pop-up clinics here and there as the need arises. We do get requests for clinics, which we still accept at this time based on the need within the population and what the parameters are for that request. We do have a pop-up clinic on the 14th of April at Flint Southwestern School. We try to make sure that we fill those requests for school-based clinics as much as possible, simply because we do understand that a later clinic at the school may be more accessible for parents to go and take their child on a Friday after school if need be, without any worries of any symptoms after the vaccine during the school day, as well as keeping in mind that parents do work. So having an afternoon clinic available to them is definitely helpful. We don't have to take time off of work to get it done. So all of our Genesee County COVID testing locations are still up and running. Our 3 HANU sites that, again, with MDHHS are testing locations as well as vaccine locations. They do offer PCR antigen testing. Greater Flint Health Coalition is offering over-the-counter COVID-19 tests. Those you can call, or you can, I assume had up there, the phone number to, sorry, my screen's blinking in and out.
Yeah. Ashley, they're by referral. By referral,
okay.
Yep, they're by referral. So if individuals want to call, they can call the Health Coalition, but it is by referral.
Perfect.
Yeah.
Perfect.
Okay.
And on top of that, USPS, United States Post Office, is still offering COVID tests to be sent home. There is a limit of 2 requests of tests per household. 4 tests come in each shipment. They are still offering those at this time. With if you go on their website to request it, those typically get mailed within your typical USPS postage time. If you need additional resources, they offer that at the USPS as well. Our community testing sites do have rapid antigen and PCR testing is available upon request. We have tried to be very transparent about the fact that PCR tests are done upon request. There was a little bit of miscommunication or misunderstanding there, so we try to make sure we clear that up as soon as possible. The parameters are still the same. No insurance needed, no doctor's notes are needed. All sites are ADA accessible. We do not need an ID. And saliva testing is available for both adults and children, as long as you don't eat, drink, chew gum, or use tobacco 30 minutes prior. Again, those are our 3 MDHHS HANU sites, which are Word of Life, Bethel, and Macedonia Baptist Church. Next slide, please. We have 2 established drive-through testing sites still, if need be. We do understand that there are those that are unable to walk in and out of the buildings. Maybe we have an unsteady gait, or it's just more convenient to do drive-through testing. We try to accommodate as best that we can in our community. So Walgreens does still have a drive-through testing site on their Davison Road location in Flint, as well as Hamilton Community Health Clinic at their North Point Clinic. Same parameters, that no insurance is required, and then testing is available for pediatric as well as adult. Next slide, please.
I think that was,
There we go. Perfect.
thank you so much, Ashley, for
Absolutely.
that very detailed information, and we appreciate it because there were some really significant updates, and we'll look forward to hearing more next time about what's going on with the hospitals, because again, as I said, that's very important information that the community is interested in. So this is the way we're trying to reduce that equity challenge that we have of making sure these sites are accessible to everyone. And so now we'll move to the Flint Center for Health Equity Solutions. We talk about equity. And so here in Flint, we want to have some solutions. Mary Catherine Crawford is going to give us an update from our health equity brief today. Welcome, Mary.
Thanks, Yvonne. Always happy to be here with everyone. So Ashley did such a wonderful and thorough job with the data, so I'm not going to spend too much time. We did see an uptick in Flint this week from 12 confirmed cases to 21 confirmed cases, but it's important to know that this magnitude is very small compared to previous weeks. So, and these small increases do not mean that significant outbreaks are coming. So with that, we'll just go ahead and move right on into the next slide. So Genesee County confirmed 3,143 cases in February and 800 cases in March. So that's a 75% decrease, which is wonderful. If we actually look at it by cases per day, our increase is actually about 77% when we account for the fact that February had fewer days than March. So it's really important to continue to examine the data in multiple ways, you know, to get the full story. So Flint did climb up a bit in case rates compared to February, but again, it doesn't necessarily mean that a major outbreak is on its way, and we'll unpack that a little bit more when we look at our density maps on the next slide. So we see like these areas of darker blue, and where there are more cases densely clustered, that's because population density is going to be a major factor in shaping the distribution of COVID cases. So the rates that we just talked about in the other slide just offer and bring a little bit more clarity to these patterns. And I'm just gonna mention this because I see him on here. Thanks to Rick Sadler for this data and for these maps, and reach out to him with your questions. And so there are two really awesome policy updates that we have not had a chance to discuss in the webinar this month, but we should celebrate nonetheless, especially since it is still Minority Health Month. So the first is that Governor Whitmer did sign into law a partisan appropriations bill allocating billions of dollars, nearly $5 billion, to infrastructure in the state. And we're talking, right, once we break that down, millions of dollars into improving areas, including our water, bridges, parks, internet access, public transit. And what I'm particularly excited about is the funding to increase housing stability in the state, which really has been a major crisis throughout COVID. So we have more money now available to low-income renters who have been especially impacted through the pandemic. So a bunch of this money is going to also go to the Homeowner Assistance Fund to provide aid for homeowners that are having maybe they're becoming delinquent on loans or in mortgages, and as a result face foreclosures on their homes, becoming displaced. So now there's more money in that fund to help people. And this, as you heard Dr. EJ mention earlier, is a social, is one of those social determinants, housing, that irrefutably affects, people's health. So this is really, really good news coming to anyone who needs a bit of extra help right now. The next policy that did become law a few weeks ago, but I would be remiss not to bring it to the table today, is the Emmett Till and Anti-Lynching Act. So after more than 200 attempts over 120 years, that Anti-Lynching Act is now federal law. And so any conspiracy to commit a hate crime that results in death or a serious injury may now be prosecuted as a lynching. Most of you know the story of Emmett Till, right? An innocent 14-year-old boy who was brutally murdered, a victim of racially motivated murder. And I think it's important to understand, well, why was a crime that was committed in 1955 still so pertinent today? Well, not only was it a tragic stain on US history, it was a major catalyst to the civil rights movement. And to this day, racially motivated murders continue to make up the largest category of hate crime incidents. And then the majority of those incidents are actually motivated by anti-Black bias. So this law is a major victory in the battle to ending systemic discrimination and reducing unjust violence against communities of color.
Thank you so much, Mary Catherine, for that update. Appreciate that so much. And we're going to shift over to the city of Flint, looking at what's happening in the city of Flint right now. We have with us our Chief Resiliency Officer, Lottie Ferguson. Welcome, Lottie.
Good afternoon. If you have not already noticed, there are speed humps going into the city to help with speeding and some traffic control. And we've put those in based on resident complaints and police data. But if you still have areas of the city where you feel there's some speeding going on that you'd like to curb, then by all means, let us know where those are. And then we've got more speed humps coming. There's also some crime watch signs along with those speed humps that are going up. Waste collection for yards has started and will go through the end of December. It's the same day as your trash pickup. If you haven't already had a place to go get a vaccine or a booster or get tested, know that the mini stations, the North End mini station and the Dordt Mall mini stations continue to have vaccination clinics. The information is on the screen. We've extended the dates for those to remain open. And then just a reminder that City Hall offices are closed on Friday in observance of Good Friday. So if you've got city business to take care of, you want to hold that off until Monday or do it on Thursday. Yvonne?
Thank you so much, Lottie. Appreciate that. Let's get our business done before next Friday with the city. We just have a really quick update. We had our survey done, and so we appreciate those of you that completed the survey. We're only going to give you a little bit of an insight from that today because more will come, and our own Dr. Heatherlyn Uphold will give us a quick insight into the survey results.
For sure. Thanks, Yvonne. So we asked for feedback and you all responded. We had 45 folks who completed our survey. We're so grateful for that information that you provided. And I just like Yvonne mentioned, I just want to give you a taste or just a little slice of the feedback that we got. We asked folks to rate a series of questions where 1 was low and 5 was high. So 1 was poor or strongly disagree, and 5 was excellent or strongly agree. And what you're seeing here are the responses to those questions, and the mean or the average that you see is above 4, close to that 5 marker, showing us that this is really positive feedback. And we've also included the SD or the standard deviation, which just tells us what does the data look like? Is it close to that mean or is it spread all far apart? And what we want is it to be is that standard deviation to be small and to be close to the mean. And that's what we're seeing here as well. So overall, how would you rate the webinar? We got a 4.3. So that's really good based on our 45 respondents. We also know that the presenters are knowledgeable, they're credible, and overall just super positive feedback that we received. The majority of survey respondents feel that it's extremely or very important that the information is shared by our local community experts. That's our Dr. EJ, our nurse T, Katie Baxter, everyone who joins us every single week to provide locally relevant information and resources, which you also said was really important. So we're so glad to be able to do this. Moving on, we got a couple more things I want to touch on. We asked you, how has information presented in the webinar been helpful for you? What'd you do with it? And 33 of you said you not only learned something new, but 32 of you said that you shared that information with someone else, which is at the heart of what we talk about every single week. And then it caused you, the webinar, something you heard on the webinar, caused you to go look up more information. Maybe you talked to somebody, looked it up online, something like that, but it really sparked your interest and you headed someplace else to get more information. You know, we've been at this for 108 weeks. So we wanted to know, what should our timing look like? And in the bottom left, you can see we've got this pie chart. It's almost broken up into thirds, but roughly 37% said keep it at a weekly schedule. Show up every Friday from 12 to 1. We'll be here. We also saw about once a month, 29%, and then twice a month at 34%. The majority of you join us through Zoom every Friday at 81% of folks. So that's your taste of the survey data.
So we thank you, Heather, because we said 12 to 1, and we've got about 45 seconds to say, continue to get those continuing education units to our social workers and our community health workers. You know what the drill is. Stay a few minutes on and you'll get that information in a Qualtrics survey so you can be eligible. We want you to continue to join us every week. Like us on Facebook and share it with somebody else. Subscribe to our YouTube channel. And of course, information is always necessary and your questions are important. So contact us at info@hfrcc.org. Always feel free to call us at 810-835-2130. And I tell you what, because you said for us to keep going, we will for a few more weeks. Join us next week for session 109, right here on the Flint Community Webinar on coronavirus. We thank you so much for joining us today, and we look forward to seeing you right here next week.